In January of 2013, I was diagnosed with remitting-recurring multiple sclerosis following an MRI and a very painful spinal tap. MS it's defined as a chronic, typically progressive disease which involves damage to the myelin sheaths of the nerve cells in your brain and the spinal cord. So my symptoms included things like vision impairment, numbness in my legs and hands, and I had some balance issues. And I've always lived a really healthy lifestyle, and I am an aerial silks acrobat, as Michelle said, and I've been, I don't know how to put the picture up there. I've been a vegetarian, pretty healthy most of my life, and so my long-term commitment to health really made my diagnosis really hard to understand. My neurologist recommended an MS therapy that involved like these self-injections that I had to give myself every other day. They were very painful, and they left me with some pretty terrible bruises. That's a picture from last year's performance. And these injections also made me really prone to infections at the injection site. So after a year of that, I was prescribed a new medication, which was awesome because it was a pill that I would take twice a day. And it was kind of described as like a sniper in the immune system. That's what I was told. But I really felt like my body was getting sniped. Maybe you feel the same when you're on medication as well. During the 5 years I was on this medication for MS, I had been battling bronchitis like 4 times a year, and I would lose my voice, which is not very good when you're a radio DJ. Like, you literally have to call in sick when you don't have a voice. So it impacted my job. I developed basal cell carcinoma right here by my eye, and I had to have a surgery in 2017 to remove that. And my doctor did say that it could be, my neurologist said, well, that could be because you're on some immunosuppressants. So by this time, I was, not only concerned about this disease that I had, but I was also concerned about what the medication was doing to my body. So my mom and I had been praying for guidance to know what to do, and around that time, an odd thing happened in regard to my medication. I wasn't able to get a hold of it, and I had to go without it, and I just happened to see Michelle Long in the dog food aisle in Walmart, and we were, embraced, talked about all sorts of things, and I actually knew Janet Pauly and stuffed envelopes to say welcome to probably many of you that I didn't know before I even started taking the AIM products. But she, I had known her mom, and I actually live like in the same neighborhood where she used to live, but she suggested Barley Life, that I give it a try, and I decided that I would try Barley Life without medication for the first time. That was just my choice because I wasn't able to get a hold of it. So my medication had still not arrived yet, which was amazing. So I thought I'd give it a try and see if it would support my immune system. And so fast forward about 7 months to the time that I had my routine MRI scheduled. It was July of 2018, last summer. So I was really nervous for the follow-up appointment because I still wasn't on my medication. I was just taking, Barley Life, and I was taking very high amounts of it. And I had heard that sometimes doctors stop seeing patients when you stop taking the medication they're prescribing. And that was just something that I had heard. It was not something I was told. So I was a little nervous. So when I began taking Barley Life, I began praying for this whole situation, the symptom management, my MRI, my doctor's reaction when I told him what I was doing, and my scheduled appointment with him in September of last year. Well, my neurologist did not drop me as a patient. In fact, he said that I had above average brain tissue. It was like my brain tissue was growing. And I had no new brain lesions, and he asked me what I'd been doing. And I shared with him that I was taking this really highly concentrated, nutritious powder in the form of a whole food juice powder, kind of combined with a healthy lifestyle, getting plenty of exercise, plenty of water. and just a healthy lifestyle, avoiding sugar, avoiding enriched bleached flour, which is in like everything, and that I was mostly vegan. He asked about my physical exercise. I explained I was still doing the aerial silks and other cardio activities as well. And I listened to my body, though, because you just have to know what you can and cannot do. So on days that I'm weak, on days that it's just not there, I have to say, okay, I can't climb up there because that's not going to be safe. So my doctor was so impressed that he told me to keep doing what I was doing, did not recommend that I get back on my medication, which I was very happy about. And then he asked my permission to share my story and what I was doing at some of the neurology conferences that he goes to. That was really exciting. As an alternative to other MS therapies, that's what they call the medication, MS therapies. So I was really thrilled, thankful, relieved, because the Lord had answered my prayers. So I give all the credit and the glory to God. And when I say I haven't had an actual MS attack since 2012. And every day that goes by, that I'm symptom-free, I really thank Him. I believe that barley life, along with a healthy lifestyle, is critical and including ample exercise, which I believe is as important as nutrition is. You got to move. I cannot say definitively, of course, that it's barley life that is managing my MS symptoms, especially since I was been symptom-free for about 5 years before this. And let me be clear, I'm not saying you should get off your medication, talk to a doctor before you do anything drastic. But I can say that after starting Barley Life, my overall health has improved. I sleep better, and as a morning radio DJ, it's really important to get good sleep. I have more energy. I no longer have like menstrual cramps. I don't have to take anything for that anymore. And I love Barley Life. Like, I crave it all day. Like, it's in my bag in the floor over there. I'm going to have it later. My journey with AIM is just beginning. I consider myself an AIM baby. I have enjoyed sharing Barley Life and seeing the AIM products help some of my friends, especially those who have Lyme's disease. I actually have 2 friends that are on, they love Barley Life. And the Ready Beats is really helping them with energy-wise, and the herbal fiber blend. So that's what my friends that have been taking. And over the last year and a half, I've seen so many positive things for myself, and I'm passionate about sharing the benefits of a healthy lifestyle and the gifts that God has given us to aid in our healing. So it's my prayer that you too will be as excited about equipping your body to have better quality of life by practicing positive health principles and then filling your body with the wonderful concentrated nutrition that just like the AIM products provide. Thank you.